Imagine sitting in a doctor's office, hearing the words, "If only we'd caught this earlier." It's a moment that no one wants to face, a preventable tragedy that begins with overlooked warning signs. Every single day, hundreds of families around the world hear this heartbreaking news, wishing they had known what to look for. Stomach cancer is often called the silent killer for a reason. Over 1 million people are diagnosed annually, and a staggering 80% of those cases are caught too late. These aren't just numbers, they're lives, parents, siblings, and friends hanging in the balance. But here's the good news. You can change the outcome. Your body gives you signals, subtle whispers that something might be wrong. Recognizing these signs early can make all the difference. In this video, we'll uncover the 8 critical early symptoms of stomach cancer that could save your life. Let's get started. What is stomach cancer? Stomach cancer, also known as gastric cancer, is a type of cancer that starts in the lining of the stomach. It usually develops slowly over many years, often without noticeable symptoms in the early stages. By the time symptoms appear, the cancer may have spread, making it harder to treat. This is why early detection is so crucial. Several risk factors can increase your chances of developing stomach cancer. One of the biggest is an infection with Helicobacter pylori, a bacteria that can cause chronic inflammation in the stomach. A diet high in salty, pickled, or processed foods also contributes, as do habits like smoking and excessive alcohol consumption. If you have a family history of stomach cancer or conditions like chronic gastritis or ulcers, your risk may be higher as well. The tricky part is that the early signs of stomach cancer can easily be mistaken for common issues like indigestion or stress. This makes it all the more important to stay vigilant about your health and pay attention to persistent symptoms. The earlier we catch stomach cancer, the better the chances of successful treatment. Signs to watch for.
1.
Persistent stomach pain. Persistent stomach pain can be much more than just a digestive inconvenience. Tumors can create blockages in the digestive tract, prevent food from passing through smoothly, and disrupt the natural balance of stomach acid, leading to ongoing discomfort. If you experience gnawing stomach pain that doesn't improve with antacids or dietary changes, it's essential to consult your doctor.
2.
Feeling full quickly, early satiety. Feeling full after eating only a small amount can indicate stomach cancer. This sensation might result from tumors reducing the stomach's capacity or blocking parts of the digestive tract. If this symptom persists despite maintaining your usual diet and activity level, it's important to see a doctor promptly. 3. Anemia and fatigue. Persistent fatigue, even after getting what feels like sufficient rest, can be an important and often overlooked warning sign. This deep, unrelenting tiredness goes beyond the usual exhaustion from a busy schedule or a poor night's sleep. It could be a result of internal bleeding caused by stomach tumors, which often occurs gradually and silently. When stomach tumors bleed, even in small amounts over time, they can lead to chronic internal blood loss. This ongoing bleeding can result in anemia, a condition in which your body lacks enough healthy red blood cells to carry oxygen efficiently to your tissues and organs. When your body doesn't have enough oxygen, even the simplest daily tasks can feel overwhelming. You might notice yourself getting out of breath after climbing a single flight of stairs, experiencing weakness in your limbs, or feeling a constant sense of lethargy that no amount of coffee or rest can seem to shake. In addition to the fatigue, you might observe that your skin looks unusually pale, which is another indicator of anemia. This type of exhaustion isn't just about being tired, it's your body's way of signaling that it's struggling to function optimally. If this resonates with your experience, it's crucial not to dismiss it as just a symptom of being overworked or stressed. Speak to your doctor about what you're experiencing and ask for a simple blood test to check your hemoglobin levels. This test is quick and can reveal whether anemia is the cause of your persistent fatigue. If anemia is identified, your doctor may recommend further investigations, such as imaging or endoscopy, to determine whether internal bleeding from a stomach tumor or another underlying issue is to blame.
4.
Persistent nausea and vomiting. While occasional nausea or vomiting is something most people experience at some point, often due to a bad meal, stress, or even a temporary stomach bug, it becomes concerning when these symptoms persist without an obvious cause. If you find yourself experiencing nausea or vomiting frequently over a period of days or even weeks, and there's no clear explanation, it could be a signal that something more serious is at play, such as stomach cancer. Tumors in the stomach can interfere with the digestive process in a number of ways. They can irritate the stomach lining, leading to inflammation, or even partially block the passage of food through the digestive tract. This disruption in normal digestion can lead to ongoing nausea, vomiting, and discomfort. Over time, as the tumor grows, the digestive system may struggle to function properly, causing food to move through the stomach at an abnormal rate or irritating the stomach further. As a result, you might find yourself feeling nauseous after meals or unable to keep food down, leading to a decrease in your overall nutrition. One of the tricky aspects of this symptom is that many people reach for over-the-counter remedies like antacids or anti-nausea medications to alleviate the discomfort. While these treatments may offer temporary relief, they can also mask the underlying problem, delaying a proper diagnosis. The danger here is that by treating the symptom without addressing the root cause, you could be allowing a potentially serious condition like stomach cancer to progress without intervention.
5.
Unexplained weight loss. Losing more than 10% of your body weight without changes in diet or exercise could be a warning sign. Stomach cancer can disrupt digestion and nutrient absorption, leading to rapid weight loss. If this occurs, consult your doctor immediately. 6. Blood in stool or vomit. The presence of blood in stool or vomit is an unmistakable signal of internal bleeding, often linked to stomach tumors. Blood in vomit might appear bright red, while blood in stool may look dark and tarry. If you notice these symptoms, seek medical attention immediately.
7.
Swollen lymph nodes. Swollen lymph nodes around the neck, collarbone, or near the stomach can indicate that cancer has spread. These lumps are typically painless and persistent. If you find any unexplained swelling, consult your doctor promptly for a thorough evaluation.
8.
Burning sensation and persistent heartburn. Chronic heartburn that doesn't respond to medication or dietary changes may signal stomach cancer. Persistent burning sensations accompanied by other symptoms like unexplained weight loss or fatigue warrant immediate medical attention. Prevention tips. Protecting yourself from stomach cancer begins with simple, proactive choices. Focus on whole, unprocessed foods like fruits, vegetables, and whole grains, and reduce your intake of smoked, pickled, and highly processed foods. Quit smoking and limit alcohol consumption to lower your risk. Regular screenings, particularly if you have risk factors like a family history or H. pylori infection, are crucial for early detection. Final thoughts. Recognizing the early signs of stomach cancer isn't just important, it's life-saving. Symptoms like persistent nausea, unexplained weight loss, or blood in your stool aren't minor inconveniences. They're your body's way of saying something could be seriously wrong. Early detection is the key to better outcomes. If any of these warning signs resonate with you, don't ignore them. Reach out to a healthcare professional and prioritize regular checkups. Your awareness could save a life. Stay informed, stay proactive, and take charge of your well-being.